Hello everyone, this is Raksamirali. Today we are going to discuss on the specific test that's related in the pregnancy, and it's used mostly in the field condition because there is a lot of the field tests, or we can say that the lab test through which we can detect the pregnancy, but this is another test that's very easy and a costless and non-invasive and very much easy to do this in a field condition, especially for the farmers. So the role of the caudal pelvic ligament test in the pregnancy. This is my topic today, the role of the caudal pelvic ligament test in the pregnancy. So let's start from the overview of the caudal pelvic ligament test. The caudal pelvic ligament test is a term that likely refers the ligaments that are located in the pelvic region. The pelvic ligaments play a crucial role in maintaining the structural integrity and the functionality of the pelvic region, which is directly involved in the reproduction in the animals. The caudal pelvic ligament test is basically what we can, if we know that the caudal pelvic ligament test is often used in animals, particularly the females, to assess the pregnancy and the parturition, the process of the giving the birth. The test involves the palpating the caudal pelvic ligament located at the pubic symphysis of the pelvic region to evaluate its tone and the softness, which can change due to the hormonal functions, or we can say the hormonal increasing and that associate with the pregnancy and the approach of the labor. So the purpose of the CPL, we can say the caudal pelvic ligament test. The caudal pelvic ligament test is primarily used as the clinical method to determine if the female animal is pregnant or if she is nearing the parturition. There will be the changes in the ligament can be linked to hormonal shifts during the pregnancy, particularly the release of the relaxin, which causes the ligament to softness, or we can say the soften in the preparation for the childbirth. Palpation and examination of the CPL, caudal pelvic ligament test. The test involves the gently palpating the caudal pelvic ligament test, which is located near the pubic symphysis, the joint between the two pubic bones. Before the pregnancy, the ligament is typically firm and less pliable, and there will be this ligament the tight before the pregnancy. But during the pregnancy, as the animal nears the labors, the ligament becomes softer and more flexible, a sign that body is preparing for the birth. It's a very key sign. So look at this. The palpation site of the caudal pelvic ligament test, as are given the arrow, a red arrow, or near the vulva or behind, or we can say the downside of the vulva at the lateral side. You can put the fingers and feel the caudal pelvic ligament test to check the ligament is firm or flexible, or is it we can say that the tight. If the tight means that the animal is not pregnant. If the ligament are the, we can say the softness and the flexible means the animal is, we can say that the pregnant. Crucial ligament alteration during the pregnancies. Firmness in non-pregnant animals or the early pregnancy. The caudal pelvic ligament is firm and tight, especially this is a key sign for the non-pregnant. And the structural support. But the softening as the pregnancy progresses, particularly as the due date near, the ligament will begin to soften, becoming the more flexible and loose. This is due to the hormonal changes such as increased relaxin production, which loosen to the pelvic ligament to allow for the passages for the fetus during the delivery. Relaxation in the animals approaching the parturition, the ligament may feel more relaxed, indicating the body is getting ready for the labor. So look at the timing and accuracy of the checking of the ligament. The caudal pelvic ligament test is more accurate in the late pregnancy, and it can provide the useful information about whether the animal is nearing the labor It may not be as effective nearly in the pregnancy. Timing of changes. The softening of the ligament typically occurs in the last few weeks of the pregnancy or just before the onset of the labor, although this can vary by the species. So look at this. We can say the species differences means there will be the differences. We can say that according to species, as the horses in a mare, the cardial pubic ligament softness significantly in the days, or we can say the weeks before the birth. But in a cattle, if we talk about the cattle and the sheep, or we can say the goat or buffalo, especially in the cattle, the softening of the pubic ligament can also be a sign that a labor is imminent. Dogs and cats, while the test can be helpful, it is not always as reliable in these species due to the differences in anatomy and timing of the parturition. Other diagnostic test methods like ultrasound or the blood test for the hormone levels, and example the progesterone, are the typically used in the conjugation with the caudal pubic ligament test. So this is all about the caudal pubic ligament test. Hope that you have gotten the great and a key point and important point regarding the CPL test, or we can say the caudal pubic ligament test. It's a field condition, a pregnancy test that is very easy, and we can say the costless, non-invasive. We can do a very easy, and farmers, once they will watch this lecture, they will be able to do their own self. They will practice, or they can get upon these tests, and hope that all the veterinarians will also know the very well about this test, and will be able to do the practice their own self, because there are a lot of the we can say the pregnancy diagnosis tests like as ultrasound and other hormonal tests, but these are the, we can say that the cost, we can say the costable, but this caudal pubic ligament test is costless, and there is no require of any instrument to use in this test. Just you put the fingers and palpate the ligament. If the ligament is, we can say that the soft and flexible, means the animal is pregnant, but if the ligament are tight, means the animal is not pregnant. So thank you so much. This is all about the